Covalent BTK inhibitors are now recommended as part of frontline therapy and maintenance in patients who are good candidates for an aggressive induction regimen. With longer follow-up, Pirtobrutinib continues to demonstrate clinically meaningful efficacy in a variety of mantle cell lymphoma subgroups, and that includes patients who have seen covalent BTK inhibitors in the past. And there's also some signal, like we talked about, to suggest that Pirtobrutinib may be highly effective in patients who have never been exposed to any BTK inhibitors. What we've seen throughout the Pirtobrutinib trials is that it's very well tolerated and it has a low rate of discontinuation due to drug-related toxicity, which is a great aspect to have in a new drug. And I think we can regard Pirtobrutinib as a new standard of care in mantle cell patients who have received a prior covalent BTK inhibitor.